And I'm Isabel.
We're with Tech East Health Science, and today we're going to be demonstrating the passive range of motion exercises for 5 joints.
What is passive range of motion?
PROM is the manual movement of joints throughout the body by a caregiver without the effort of the patient.
Why would they need to do that?
It is done when the patient has a condition that doesn't allow for independent movement. It's usually within the initial healing phase to aid in joint rehabilitation.
Oh, so it's important for patients because it helps promote flexibility, prevent stiffness, and promote blood flow throughout the body?
Exactly. It's also a useful diagnostic tool to identify and assess limitations in joint and soft tissue function. Let's go demonstrate a few. Before you start, make sure your patient is comfortable and knows what you'll be doing.
Hi, I'm Haley, and I'm going to be doing the ranges of motion act today. Is that okay?
Yeah.
Okay, please let me know if you feel comfortable at any time.
Make sure the bed rails on the side you'll be doing the exercises on are lowered and that the bed is at waist level.
I'm first going to be working on your shoulder. Correct hand placement is important for all these movements. I'm supporting the patient's wrist and elbow with one of my hands.
Slowly and gently bring the arm up and over the head, moving toward the ear. Make sure the arm stays straight and that you're fully extending it. Hold for a few seconds at the top and then bring the arm back down slowly. This is called flexion and extension. We will do 3 reps for each movement in the video, but it will depend on the doctor's instructions.
Next is abduction and adduction, and I'm supporting the patient's wrist and elbow.
You want to move the arm to the side of the body as if the patient is stretching and bring it back in.
Lastly, for the shoulder joint is internal and external rotation.
You want to position the arm at a 90-degree angle and then move the forearm up to the head and then down to the body.
Next will be the elbow.
Wait, this is a common mistake that can cause pressure injuries. You want to support the upper arm and forearm to target the elbow joint while preventing it from rubbing against the sheets. Bend the elbow by pushing their hand to flex the lower arm to their shoulder, then extend back out. Next, hold the wrist and elbow and alternate the arm between a supine and prone position.
Staying in this area, we're going to be doing the wrist joint.
Hold the forearm to stabilize the wrist. Fold the wrist forward for flexion, neutral for extension, and back for hyperextension. Then, turn the wrist to the thumb side for radial flexion and the pinky side for ulnar flexion.
Next, we're going to be moving down to the hip joint. You want to support one hand under the knee and one under the leg.
For flexion and extension, raise the leg and bend the knee, and lower it back down. Then, we'll do abduction and adduction. Move the leg outwards and back in.
For the last joint, we will do the knee. Raise the leg and bend the knee at a 90-degree angle. Make sure to support the knee by placing your hands under the knee and ankle. A common mistake that people make when performing PROM is not moving slow enough. Make sure to move the joint slowly and thoroughly to ensure it reaches its full range of motion. You flex and extend the knee by bending at the joint and then straighten.